We're at Broward Health Imperial Point, and I'm outside of the emergency entrance. Hopefully you don't end up here, but I'm headed inside to meet Dr. Carralero to find out what happens if you do. Hey there, Dr. Carralero.
Hi, Hunter. How are you?
I'm good. Thank you so much for having us here today in your beautiful emergency department. Tell me about what goes on here.
Thank you for coming in. We are an emergency department in Fort Lauderdale, and we are a general emergency department. We take care of every patient that comes through the door, from newborns to elderly people.
One of the things that I think people think of most when they think of the worst case scenario of an emergency is heart attacks. Now, how do you handle heart attacks here?
Heart attacks handled in one of two ways. Either they come in by EMS or they walk in through the door. Those two are handled slightly different, but either way, you want to be able to get a quick EKG on a patient, diagnose them with a heart attack, and activate a cath lab.
What is a cath lab?
A cath lab is a dedicated part of the hospital in which we take patients that are having an acute heart attack, and we take care of them there. An interventional cardiologist will puncture the groin or the wrist and put a device that'll open up the artery and allow blood flow to the heart.
And that's a life-saving event.
That is a life-saving event.
And which symptoms are the cues to, okay, I should go? When is it the time to go make sure you don't have a heart attack?
Chest pain, shortness of breath, sweatiness, and nausea are the typical symptoms that you should look for.
Those are the, like, you should go now.
You should go now.
It's not something that, oh, I'll just sleep it off and I'll be okay. It's
correct.
Go now.
Yeah.
And what makes Broward Health different than other hospitals?
At Broward Health, I think the people are what make Broward Health different. I mean, we have a great team of dedicated emergency physicians that are board certified. We have a great deal of PAs, nurse practitioners, dedicated nurses, techs, and paramedics that want to take care of our community, basically.
When it comes to technology, how is Broward Health different from others, and what do they use to treat a heart attack?
Well, we invest heavily in technology, and I think it starts off with EMS. When they encounter a patient with a heart attack, start up a cardiac alert, and they will send us their EKG. That EKG will be sent through the web, through one of our displays, and we'll be able to see it before they get here. And that will cause us to activate our cardiac alert and bring our team in so that we can take advantage of the time.
Because as in most situations that are emergency, but especially with a heart attack, the faster you get to solving the problem, the more likely to have a better outcome.
What is happening physiologically is that you're not getting enough oxygen to the muscle of the heart because there's a blockage in the artery. The quicker you can reestablish that blood flow and oxygen supply to the muscle, the better the recovery will be for the patient.
Thank you so much for your time.
Thank you.
Appreciate it.